Hi Rumi. Hi Shakti.
Hi.
I'm good. How are you? Finally there. Good afternoon, Rumi. I'm so sorry. I just jumped in.
Hi, Vijeta ma'am. How are you?
I'm good. How are you? Good afternoon, Vijeta. Good afternoon, Dr. Partha.
Partha, your mic is on mute.
Yeah, good afternoon, everybody.
Good afternoon, sir. Good afternoon, everyone. Hope everyone is having good time today. Friendship Day, huh? Everyone is celebrating nice. Yeah,
Happy Friendship Day.
happy Friendship Day.
Shall we proceed or we'll wait for 2 minutes for Dr. Irene and Dr. Apurva? It's 3:05. I think we should start. So rest of the people they'll join us accordingly. Raina ma'am, Parthada, shall we start?
Yeah, we
Yes,
can.
yes, Rumi. Good afternoon, Dimitris. Good afternoon.
Shall we go? You can start from your link. So today is World Breastfeeding Day. So I'm Rumi on behalf of Janni Tree family. I'd like to welcome everyone. So we have Dr. Bhartapratim Bora here. He is the senior consultant pediatrician from Pratiksha Hospital, Guwahati. Then we have Raina Khatri ma'am. She is the CEO of Right to Rise and she is the national secretary of NCWD. And we have Vizeta Goel ma'am here from Bangalore. Then we have Sakti Mishra and other teammates are there. They are live from Facebook page. So at the very beginning, I like to request Raina ma'am to inaugurate the event.
Thank you very much, and a very, very warm welcome to everybody out here. Such a proud feeling and great applaud to Rumi and the entire initiative of Gen 3. I am very proud to be a part of this lovely initiative where you have made the easiest way to reduce preventable diseases is the need for breastfeeding. And it's not a responsibility, it's not a choice, but it's everybody's role that even if we are anywhere around, we help these mothers and this initiative so that every newborn baby has all the three demands: care, warmth, and a lot of security that we get from mothers. I wish you all the best and great luck for this beautiful, beautiful initiative, Rumi and Dr. Shakti and the entire team of Gen 3 with great esteemed members today, Vijeta ma'am, Dr. Partha. It's really wonderful to be here. I wish you all the best, and yes, you may inaugurate the session to start.
Thank you, ma'am. So Dr. Apurva, he has got a emergency call from a critical care ICU. So there is a COVID emergency. So we have a video from him. Please allow me to play the video. There is a network issue, so connection is a bit slow. There's a network issue, connection is very slow, so we'll move to the next schedule. So here I'd like to request Dr. Atrupatim Bora to present his presentation, that is the topic of importance of breastfeeding and a myth of related to breastfeeding. Thank you.
Thank you, Rumi, and thanks to Team Janitri, Raina Khatri, Dr. Shakti, Vijayata Goel, everybody for inviting me and giving me the opportunity to talk in front of this August, the virtual gathering, basically. So we know that this first week of August, we always celebrate it as the World Breastfeeding Week. And this year, the breastfeeding, this year is also, we will also be celebrating the breastfeeding week this year. I would like to request, yeah, Rumi, thanks. The topic for today is the importance of breastfeeding. To introduce myself, I'm Dr. Partha Bora. I work as a consultant pediatrician at Patiksha Hospital. See what the most important gift that nature has given to all mothers and to all mammals is that the art of breastfeeding, and this breast milk is always species specific. See, for all in the animal kingdom, every mother can produce its own milk for its own infant, and that is how they can help the growth of the infants. So, and it is always irrepressible and it is always irreproducible. So, this is one of the best gifts that the nature has given, and that we should take full advantage of it. We all know that the breast milk has got an immense importance, not only in the terms of survivability, also in terms of giving good nutrition, protecting health, as well as both in terms of short and long-term health in our children, and helping our children. So, Rumi, I'll tell you when to send the slide. Yeah, keep it there, keep it there. So, it is important that we promote breastfeeding. So, this is why the theme for this year is the protecting breastfeeding, and where lies the responsibility. So, this year the main idea, the main theme is to protect breastfeeding, basically. So, we have to make aware all the healthcare providers, so that we don't advocate the use of other products like baby products, like milk products, and other bottle feeding. We have to prevent those things, and we have to implement the IMS Act, so that we can help in protecting as well as promoting breastfeeding. Next slide. Rumi, next slide. Yeah. So if you look at the NFSS status, in our children. What we have seen that which was just released in the month of December last year, we could see that there is a lot of improvement in the health sector, especially if you could see that the delivery rate in the institutional delivery and has gone up to 88%. But with the increase in the institutional deliveries, the breastfeeding initiation within the first 1 hour of life has not gone up. It is still around 51% of the mothers, they initially initiate breastfeeding in the first hour. And what we see is that it is more commonly seen that in the public or in the government sector, the initiation of breastfeeding is earlier in compared to the private sector. And whereas if you see, look at the exclusive breastfeeding rate among the children in the first 6 months of age, it is hardly 61%. And if you see the complementary feeding is also very poor, around 56%. Next slide. So if you look at the different states, how they have compared, you see that there's an immense, compared to 2015-16, there's improvement in the breastfeeding parameters within the first 1 hour of birth. Within the northeastern state, Meghalaya has seen there's an increase in around 18.2%, but whereas the states like Sikkim and Assam, there's a decline in the initiation, whereas although the institutional birth rate has increased. Next slide. So, what are the recommendations for infant and young child feeding? What is why college there should be exclusive breastfeeding for first 6 months of age, and there has to be continued breastfeeding for up to 2 years or beyond. And then we have to introduce nutritionally adequate and safe complementary food once the child reaches by around 6 months of age. And while we advise mothers to continue with breastfeeding for first 2 years of age and beyond. Next slide. Next slide. So what do we understand by exclusive breastfeeding? So there's a very interesting study which we conducted in the girls' colleges in Guwahati, basically, to understand the knowledge of exclusive breastfeeding in would-be mothers, in mothers who are in the graduation courses, and we were very saddened to effect see the results that only 20% of the young woman has the knowledge about exclusive breastfeeding. So by what we mean by exclusive breastfeeding is that we give only breast milk to the babies, except for medications. We continue only breastfeeding for the first 6 months of age. And apart from that, we don't give any food, drink, water, honey. We should not give anything to the baby for the first 6 months of life. Next slide. Rumi, can you switch off your mic? There's a lot of interference. Thank you. Thank you.
Just give me one
So,
moment.
if you look at the breast milk composition, yeah, thank you. Thank you. Now there is no disturbance. Go to the previous slides. Go back. Go back. So if you look at the breast milk composition, basically the breast milk composition, if you see, it's very dynamic and it changes with as the baby grows, basically. And for the first 3 days of life, what we get is the colostrum, and then followed by transitional milk, which lasts for around the first 3 to 10 day of life, and then the milk matures basically. And for the first 2 years of life, the milk, the quality of the milk changes as the baby grows, and according to the demand of the baby, the milk changes. Next slide. So if you look at the composition of the human milk, it's diverse, and it just nature has given everything in the right proportion for which the baby requires. If you look at the protein quantities, approximately 75% of the nitrogen containing compounds in the breast milk, and the proteins of breast milk can be divided basically into the basilar caseins, and the most important are the whey proteins, and the caseins to whey ratio is around 40 to 60. Although the iron content in the breast milk is very low, but the bioavailability is very high. So whatever the low content of iron is there, it is adequately absorbed by the baby, and it helps in the brain growth basically, and also in protecting against the infections. So lactose concentration present in breast milk also increases over a duration of feeding, and the largest component of whey in breast milk are alpha-lactalbumin and the lactoferrins. Next slide. So as I have already said, the breast milk composition is very dynamic. In fact, if the mother delivers a preterm baby, the milk composition is always different. The protein content is quite high in a baby in the milk of a mother who has delivered a preterm baby, because this baby will require more of a higher amount of protein as compared to a baby who is born at term. And again, according to the stage of lactation, along if there is colostrum in the first 3 days of life, followed by mature milk. And usually, when the baby's mother is feeding, milk also comes in two stages. The first part milk, which is called a fore milk, it contains the mostly lactose, mostly watery, and it contains a lot of fats. And hind milk always help us in the satisfaction of the hunger. And it is the baby, when the baby adequately takes the hind milk, it helps in babies to grow in its weight, as well as help in babies all round growth. Next slide. So colostrum is basically is the first immunization, as we might say, but because it is very high in antibody, it contains immunoglobulins. It helps in it contains a lot of growth factors, and is very rich in vitamin A as well. So it protects the baby from infection, from allergies, and it also helps in clearing meconium. It also acts as a purgative, so it helps the baby to pass the first stools. So that if you can, baby can pass the first stools within the first 1 or 2 days, within the first 48 hours. It also helps in preventing jaundice in the babies. It helps in maturation of the intestine, especially in preterm babies. If you feed them with the colostrum in the first milk, it colonizes the intestinal flora, and as well as it prevents the baby from getting any intestinal infections, as well as it prevents the child from getting the two dreaded disease, which contributes a lot to our under five mortality, the diarrhea as well as the pneumonia. Both these diseases can be prevented if the baby is allowed to take the colostrum, as well as since it is very rich in vitamin A, it prevents measles as well as the eye diseases. Next slide. So when you talk about importance of breast milk, basically what is the benefits of breast milk to the baby? So breast milk and the human colostrum are made for babies, and the baby's first food. They're easily digested and well absorbed. It contains a lot of essential amino acids. And I'm going to talk specifically about the protein content and the breast milk, which will help the baby, and which will actually differentiates between the human and the animal world, the brain growth basically, which makes us superior in the animal kingdom. It is also rich in very essential amino fatty acids, and of course we have discussed about the bioavailability of the iron as well as the calcium. Breastfeeding also helps us in, as I have already said, they decrease the under five mortality, especially from the two diseases like diarrhea and pneumonia, and also helps in preventing infections like measles. It prevents allergies. It also helps us giving better intelligence. And the most important, there's an emotional bonding between the mother and the child. And it decreases the incidence of heart diseases, diabetes, and lymphomas. Now, there are a lot of studies which have actually documented that the obesity in children, which we commonly see in our school-age children nowadays, and the incidence of having diabetes in the early age group, both this can be prevented to a greater extent if the child is exclusively breastfed during the first 6 months of life. And if we can continue with breastfeeding, it's usually for the first 2 years of life. Next slide. So the breast milk basically is the gold standard of our protein quality, and the most important is the whey casein ratio. And if you think compare with the cow's milk, and we'll see that the whey protein ratio, which is whey is the best good quality protein actually, and it's around 70 to 80% of the content of the human milk is whey protein, compared to cow's milk, which is around 20% only, and 80% of the cow's milk is casein. So it is very difficult for the baby to digest the cow's milk, especially in the first 6 months of life. And this is why they're not able to digest the cow's milk, and it causes literally to intestinal malformation, prunes the intestine to infections. Next slide. So we will be basically discussing about the brain development in babies, which is mostly contributed by the first 6 months of exclusive breastfeeding. So when we are born, basically, there's only 36% of the brain growth. So within the first 1 year of life, around 75%, 70% of our brain growth completes. So because of this, the brain requires abundant amount of energy and nutrition, which acts as a fuel for the brain growth. There is, if you look at the nerve generation, the neurogenesis, we call it the synaptogenesis, and this networking of nerves that occurs inside the human brain These are all been fueled by the contents of the breast milk, and the breast milk contains proteins and fatty acids which are essential for the adequate development of the human brain. And there's more than 60% of the newborn energy intake fuel brain functions and growth. And then if you see, there are around 40,000 synapses. These are the networkings which are occurring per second in the first early days of life. Next slide. Next slide. So now you can click again, Rumi. So if you look at the functional benefits of the structural neurodevelopment, basically what the new concept is the first 1,000 days of life, including the first 365 days of the pregnancy and including the first 2 years of life, which you call it the first 1,000 days. And this is the first 1,000 days, the most important in terms of nutrition, survivability, as well as bringing down the short-term as well as the long-term morbidities in children. If you look at the brain development, Rumi, Rumi, you can click again. Yeah. If you look at the brain development, the most of the brain development that occurs and most of the cognitive development, that is the sensory developments, the language development, and the higher cognitive function, this mostly they acquire most in the first 6 months of life. And this is the period when there is, as I have said, the maximum neurogenesis or the neurotogenesis occurring. And for good cognitive development, it is the nutrition that helps the brain to grow. And breastfeeding is the best way for developing the cognitive ability of the child. Next slide. So there are key ingredients that helps in the brain. Next slide. So if there is the long chain polyunsaturated fatty acids, we must be hearing a lot about the DHAs nowadays, the arachidonic acids, iron, choline, and of course iodine and vitamin B12 and folic acid. All these play a major role in the brain development. So what are the different studies that have, next slide, that has shown us? So if you look at the breastfeeding and the breast milk feeding, basically, there are a lot of studies which have now shown that the intelligence quotient in a child dramatically increases. And there are a lot of studies which have, these are studies which have been conducted in Denmark. If you see, Denmark is basically a milk producing country, a cow's milk producing country. But it is one country which has almost 100% exclusive breastfeeding rate. And this is the country which produces one of the most intelligent people all over the world. And there are studies which have shown that children who have been exclusively breastfed for the first 6 months of life, there's a 3 point higher IQ in children compared to children who have been non-breastfed. Especially children who are born very low birth weight. That is, children whose birth weight is between 1 kg to between 1,500 grams. In those children, if they are breastfed for first 6 months of life, they've got a IQ of 5 point higher comparison to the children who have not been breastfed. So when there is no breastfeeding, it can lead to several infections in children. The commonest is the otitis media or the ear infections, and this can lead to poor verbal IQs, leading reading and behavioral quotient also goes down in children by the age of 13 years. Next slide. So now there are also studies which also contributes that the breastfeeding also decreases the long-term morbidities in children. Especially if you look at the allergic disorders, there are prospective birth cohort studies which have shown that children who have been exclusively breastfed, the incidence of asthma, atopic dermatitis, as well as allergic rhinitis. Allergic rhinitis is basically running nose. Atopic dermatitis is skin infections in skin allergies in children. All the incidences comes down dramatically in comparison to children who has been not been breastfed or breastfed for a shorter period. Next slide. So there are a lot of protective factors in human milk. We know about the immunoglobulins and the anti-inflammatory factors. It also factors that protect against microorganisms. We know about the bifidobacterium species in infants in the human milk, as well as there's a bacteria, basically good bacteria, which have been, which also are contributed from the flora of the maternal breast, and this also provides forms the first intestinal microbiota, and that there are a lot of studies actually which has now shown that children with good intestinal microbiota can have better brain development. The what we call as the irritable bowel syndromes in adults, those the incidence of irritable bowel syndromes can also be be brought down with a good intestinal microbiota. So there are also other factors like insulin-like growth factors, the cell macrophages and lymphocytes in the milk, the leukocytes, which also contributes and prevents the babies from infections. So their protection against infection from the when the mother gets infected, the maternal antibodies are transmitted through the breast milk. Mother antibodies to mother's infection secreted in milk to protect the babies. There are also WBCs or the leukocytes where the mothers make antibodies to protect protect the baby. And some also WBCs are also excreted through the breast milk, and they also produces antibodies, and therein protects the baby from infections. The promoting breastfeeding and exclusive breastfeeding for the first 6 months and continue it for first 2 years is not only beneficial to the baby, it also helps the mother a lot. There is involution of the uterus, where the uterus can be brought down to the normal shape by within the first 6 weeks after delivery. The postpartum hemorrhages also comes down, and also it also there's a term called lactational amenorrhea. When the mother is exclusively breastfeeding for the first 2 years of life, it also acts as a contraceptive. So this also can give a gap between the two children, and it also acts as a prevents accidental pregnancies. So it decreases the mother's workload, it saves time and energy. And in maternal studies have shown that the incidence of breast and ovarian cancers also comes down. And the most important thing that the mother can reduce the weight faster if the mother is exclusively breastfeeding. Because whatever fat she has accumulated during the antenatal period, it all gets dissolved. And that actually contributes to the milk production. And that is how mothers can lose weight if they exclusively breastfeed for the first 6 months of age. There's benefit to the family and society as well. It contributes to the cell survival. It will decrease the under five mortality. It saves money, of course. If you see, there are studies which have shown that a baby who's not on exclusively breastfed, who can spend up to 10,000 rupees a month, and that money mother can save. It promotes family planning, and also it's of course environmental friendly because the whatever there's a lot of carbon emission while producing this tin milk, as well as because of the use of these tins and other products, we contribute to the environmental pollution as well. So I just added few slides for because this is a period of pandemic. There's COVID going around. So what are the breastfeeding policies that we need to advocate for mothers who are antenatally diagnosed with COVID positive, or mothers who have been diagnosed with COVID at the time of delivery? So if the mother is asymptomatic and if she doesn't have any symptoms, the baby can be kept along with the mother, and we should encourage exclusive breastfeeding in these babies. And if the mother is, of course, has some symptoms of cough, fever, or dyspnea, or baby needs an ICU care, then of course the baby needs to be separated. But in those cases also, we can continue with breast milk. And of course, the mother has to follow the COVID protocols like hand washing, wearing mask during expression of the breast milk or during breastfeeding. So because there is no evidence of transmission of SARS-CoV-2 through breast milk, and both express breast milk and exclusive breast milk should be continued if the mother wishes and if the mother is asymptomatic. So, of course, we have to maintain the hand hygiene practices. And if the mother is asymptomatic, it's better to continue with direct breastfeeding. And if the baby requires admission in the NICU or the mother is sick, then express breast milk can be used to feed the baby. So, in summary, around 8 lakhs babies' life can be saved every year. And delaying breastfeeding by 22 to 23 hours after birth increase the risk of dying in the first 28 days of life by around 40%. So delay by 24 hours increase the risk by around 80%. So optimal breastfeeding add around $302 billion to the global economy annually, and 20,000 deaths due to breast cancer could be averted. And on average, babies on breastfeeding have a 2.6 point higher intelligence quotient. Thank you. Rumi, you are in mute. Rumi, I can't hear you.
Hello.
Yeah.
Am I
Yeah, I
audible?
can hear you now.
That is a
Yeah,
very
yeah.
knowledgeable session. Thank you so much, Parthoda. So Parthoda is everybody in Assam knows him. So there no need of introduction required for Assam. So other audience who are not from Assam, they can write to us or they can send messages if they have any queries or question, or if anyone is interested in breastfeeding, they can also write to us. There is a connection issue, I think, from Dr. So we'll move to the next schedule. So, Vijayta madam, are you there?
Yes, yes, I am here.
Am I audible?
No, your voice is glitching a lot, so not very clear.
Vijayta madam, I'm audible.
Yes, you are audible.
So I would like to request Vijayta Goel to enlighten us with the nutritional requirement for breastfeeding or for the moms.
Yes, just give me a moment. So you are able to see my screen?
Not yet, madam.
Not yet.
Now?
No, ma'am.
Yeah, it's there. Just give me one.
Yes, ma'am. Starting now.
Yes?
It's come.
Okay. So every year, this World Breastfeeding Day is an annual celebration. So means we'll celebrate it every year during the first week of. Rumi, can you please be on mute because it's a lot of disturbance. I'll lose my train of thoughts.
Yeah. Just give me one.
Yeah. Okay. Thank you so much. Thank you. So, World Breastfeeding Week is an annual celebration. So, means we'll celebrate every year during the first week of August. So, it's not an event of 1 or 2 days. It's an event of full 7 days, a full week. So, where we are promoting, the goal of this program is to promote the exclusive breastfeeding for the first 6 months, which prevents the mother and the infant from various diseases like the pneumonia or the fostering the growth retardation. So, it's very important. We need to address this. And the breastfeeding, one thing I would like to say to everyone means everyone from the 5-year-old to the 65-year-old male. It's not a taboo. It's not a taboo. We have to accept this because the female is supporting a new life, and with all the support, it becomes little easy for the female. So, as we are seeing a lot of postpartum depression also in the females during the COVID times, also because there is a lot of restrictions and the mother is going through a lot of hormonal imbalances and there is a lot of restrictions. So please be supportive, and it's not a taboo. Again, it's not a taboo. So let me introduce myself, who I am, why I'm taking this session, so it will be little easy to little connect with each other. So myself, Dr. Vijayta Goel, I'm a nutritionist, wellness consultant, a physiotherapist, author for the Punjab National University. So lifestyle and wellness consultant. I'm a professional corporate trainer and speaker, member of an International Diabetic Food Association with the registration number INA 2014. So, some of the facts I would like to clear here during the when the female enters from the pregnancy to the lactation period. Okay, so that period. So have there are some facts. So I just want to clear that a 3.2 kgs full term baby is born with 300 ml of blood, 50 grams of protein, 30 grams of calcium, 15 grams of phosphorus, 300 to 400 mg of iron. So this much goes into a baby, and this is all because of a female. Okay. So, and the lactation, what is the lactation now? Lactation is a process of production of milk through the mammary glands. So it is secreted through the mammary gland, and the prolactin is the hormone which initiates the lactation, the secretion of the milk. So now why we are talking about the lactation and why we have to support that, and why we are talking about the exclusive breastfeeding during the first 6 months. So the first milk, what you will get after the pregnancy, which is for the first 2 3 days, what the doctor spoke about it, we'll call it as the colostrum. Okay, it's a white yellowish liquid, so which is secreted for the first 3 days. And why it's so important to feed the baby within the half an hour or 24 hours of the delivery, because that liquid contains a lot of WBCs, white blood cell, which provides the good immunity. It has the good antibodies, and especially your fat soluble vitamins like A, E, and K. So that's why the colostrum is very important to be given to the baby during the after the delivery, and in the first 2 3 days. And as these as the days passes, that colostrum also reduces. So it's very important to feed the baby. So as the mother body, so after the pregnancy goes through a lot of hormonal changes, there is a too much of up and downs in the hormones. So because of that, the dietary requirement or the dietary adjustment increases a lot from the pregnancy itself, because the basal metabolic rate of the female increases by 20 to 25%. So which means the additional 500 calories per day has to be addressed in the diet. And due to the formation of placenta also, the nutrition requirement increases. So lactation is the production of secretion of milk from the breast, okay, to nourish the infant. Human milk is formulated to meet the nutrient needs of the infants for the first 6 months of the life. So the human milk, the female, the breast milk is like has the appropriate amount of all the ingredients. So if you will see the composition of the, if you will see the composition of the milk, it contains almost 87% of water, 1% of the protein, in which the whey is also very good. So it's like a proper balanced meal for the infant. So what are the benefits of breastfeeding for the infant? Breast milk has the perfect composition for the baby needs, what the baby requires. No baby is allergic to the mother's milk. So we haven't seen till now ki the baby is like tolerant to the mother's feed. It's economical also, so you can save your money. Human milk contains, so why it is better than the formula milk? Because it contains at least 100 more ingredients which is not found in the formula milk. So it reduces the ear infection, diarrhea, pneumonia, allergies, and hospital admissions. Breastfeed babies receive antibodies from the breast milk, which helps to bring up their immunity. So that's why we'll see the breastfeed babies has a good immune system than the bottle-fed baby. They now and then they fall sick. It promotes the good jaw development in the babies, decreases the risk of obesity later in the life. And we have seen these cases in the gestational diabetes cases also, or the family history of the diabetes also. The baby who are exclusively breastfeed for the first 6 months and the mother has continued for the 2 years, the obesity risk is much lower, and the diabetes risk is also much lower in babies. And important thing, it facilitates the bonding, which is the one, and the I think the most important thing has to be done from the first day, the bonding between the mother and the infant. Breastfeeding is economical. It provides opportunity for the resting to the mother and the baby, which gives them the time for the bonding. So it's very important. Milk is always at the right temperature. You don't have to bring the milk from the fridge and heat and give it to the baby. So it's always as the right temperature, and it's readily available if you have a sufficient milk production. And for the mother, so breast milk helps to reduce the weight gain during the pregnancy, because if you will feed the baby, the energy consumption is like 600 kilocalories per day. So stimulates the uterus to contract back to its original size, and it it prevents the chances of having the uterus cancer also. So now the nutrient requirements. So as the body is going through a lot of hormonal changes and all the physical, mental, and everything is like adjusting during the lactation and the post-pregnancy phase. So the nutrition requirement also increases like 500 calories per day. So which means I'll tell you what will be the requirements. Most nutrient requirement increases, especially the protein, because Indian diet is not enough in protein. So we have to major emphasize on the protein, because the proteins are the building blocks of the cells. And your immune cells are also like 60 to 70% are made up of protein. So you have to specially emphasize on the protein quality and the quantity. Nutrition should be based on my pyramid plate. So like it should be like 6 ounce, like 200 grams of your whole grains in the diet, and it should be like 5 servings of your fruits and vegetables, your 2 to 3 servings of your dairy, and the oil has to be minimum to the minimum. And if you are a non-vegetarian, it has to be like 5 ounce in a day, like 150 grams. So the fluids plays a major role during the lactation, because it helps to get rid of the toxins, keep you hydrated, and the milk production, whatever the milk production is having, the fluid intake plays a major role. So what the nutrient requirement during the lactation? So as we know, the calorie requirement is 500 kilocalories per day is increased. So the calorie requirements goes to 2000 to 2500 per day. The protein, depending upon your weight, how much you have gained and what's your medical condition, it depends, it ranges between the 70 to 90 grams per day. So it has to be like, you have to calculate and properly every meal should have like 20 grams of protein in your diet. So whether it's your breakfast, lunch, or your dinner, so 20 grams of protein has to be. Minerals, calcium, it has to be 1000 mg per day. Vitamin C, because it's antioxidant, so 120 mg per day. Also, vitamin A and B complex also plays a major role during the pregnancy and the post-pregnancy, and the increase the fluids. So as the most chemicals pass through the mother's milk, so if you are on any kind of medication or the nutrient supplements you are trying to take it, consult your gynae, so that she'll guide you properly whether you can have it or not. Caffeine has to be restricted in the diet, because it makes the infant irritable. So what are the do's and don'ts for this during the lactation period, what you should eat and what you should not eat? So basically, do's are like you can eat anything. There is no restriction. Just you have to eat everything in moderation. Yes, the whites has to be lower down, like your white flour, white sugar, and the other processed foods. It has to be to the minimum during the first 40 days, because your body is going through a very healing process, and the many changes, hormonal changes, and that's why it's very much important that you should concentrate first 40 days on your diet. It should be like good rich in carbohydrates, like your millets, whole grains, because during the night feeds and everything, the morning when you will wake up, that provides you the immediate energy. So your first meal should be like whole grains in the morning, so it provides you your diet should be consist of berries, your handful of your nuts, which provides you good amount of protein, healthy fats, omega-3 fatty acid, which will help you in the healing. And there are some myths also, the lactating woman should not consume tomatoes, papaya, and all that. So, but the tomatoes are very good source of vitamin C and lycopene, so which will help in the healing process. So there is no restriction. Do's are very easy. And don'ts, there are some don'ts during the lactation and the pregnancy which you have to follow. First is like there should be a caffeine restriction, because 600 mg of caffeine if you take per day, it comes to like 6 to 7 cups of coffee or tea. Coffee especially, because it's a stimulant, it can stimulate your uterus contraction, which can lead to the abortions and the stillbirth, so because it crosses the placenta barrier. So the caffeine has to be reduced below 600 mg per day. So 1 to 2 cups are perfectly fine. The second is your alcohol. So we have seen that 100 ml of alcohol, if a lady is consuming 100 ml of alcohol twice a week, just twice a week, it puts the baby to the risk, 80% more risk for the stillbirth and the alcohol fetal syndrome, in which the baby is stillbirth, the mental retardation is there. So it's very important, if you are planning for the pregnancy, you have to cut down on the alcohol, or it's totally a no. The third one is your smoking. We all know the harmful effects of smoking. I need not to go through the smoking side effects, but smoking can reduces your vitamin B12 levels and vitamin B12 levels, and with the alcohol also. Alcohol reduces your vitamin A levels because it leaches the calcium also from the body. So vitamin A, the poor status of vitamin A is the major risk factors during the lactation and the pregnancy for the infants, because the poor status can lead to the stillbirth, mental retardation, and all these diseases like the neural tube defect and the spina bifida. So these can be prevented by the supplementation. That's why we see the gynacs are very particular about the folic acid, multivitamins, your calcium, your vitamin D. So these things has to be properly in the place if you are planning for the pregnancy or you are lactating. Okay, so these are the do's for the your lactation. So on a whole, a pregnant woman is most likely to remain healthy and bear a healthy infant if she follows a very well balanced diet. Anemia and hypertension. Anemia and hypertension are the two major conditions that can be caused by the inadequate nutrition. So these both are linked to the low levels of vitamin B12 and the vitamin A status. Calorie and most nutrient requirement increases for the pregnant and the lactating woman. So you have to be little conscious about your diet during the pregnancy and the lactation. So breastfeeding do's and don'ts. So here it's a small one. So eat more and eat less. There is a difference between eat less, avoid, and restriction. Eat less, yes, you can have it, but in a lesser quantity, because some are the nightshade vegetables when you are going through a healing process. So your gut is not that ready to take all the hard things. So that's why we'll put the female on a semi-solid feed, which is little bland, less in salt, less in sugar, because for the good healing. So eat more comes your handful of nuts, your apples. Apple pears has to be stewed, because sometimes the apple and pear can give you the gastric, and if you have gone through the cesarean section, so it can trouble you. So you can little poach it and have it, your apples and your pears. Avocado, bananas, barley, your soup, beetroot, buckwheat, carrots, your celery, your chamomile tea, which will help to balance the hormones. So your corn, your eggplant, fennel tea, very good for your post pregnancy, and it help in increasing the milk production also. Your fennel tea, your green bean, honey should be raw. Okay, it should be organic and the raw. Your millets, nut milk, mushrooms. Mushrooms are very good source of vitamin D. So whenever you will, if you are a fan of mushrooms, so before cooking it, just keep it for 15 to 20 minutes in the sunlight for the better absorption of the vitamin D. Pumpkin, your potatoes, your rice milk rice, rolled oats, your rice, sesame seeds, sunflower seed, sweet potato, tahini, tofu, walnuts, yogurt. These are the best food during the breastfeeding, what you can indulge into. And eat less. These are all the nightshade vegetables. So you have to avoid the strong herbs like your red chilies, black pepper, your oregano, rosemary, your stimulants like tea, coffee, your alcohol, your cold drinks, your chocolates, your any kinds of antibiotics. Okay, apricots, berries, cabbage, cauliflower, cucumber. These are all the nightshade vegetables. That's why we have put it into the eat less. You can have these things in the your lunch or in the mornings, but try to avoid it in the your dinner. Okay, your tomatoes, why we have put it in the tomatoes in the eat list? Because the seeds of the tomatoes is not easily digest. If you remove the seeds and you want to have this tomato as a salad, you can definitely have it. So, and what are the do's and don'ts during the breastfeeding? You have to exclusively breastfeed the baby for the 6 months, and you can continue with the external feed till 2 years. Frequent feeding every 2 to 3 hours interval. Encourage the night feeding. Practice correct technique, positioning, and attachment. You can ask your gynae. And post every feeding, hold the baby upright for the 10-15 minutes for burping. Eat healthy food and drink plenty of water. Herbal teas are great to heal yourself during the lactation period. Don't feed in the sleeping position because sometimes it can choke the baby. Don't forcefully detach baby from the breast while feeding. Don't discontinue breastfeeding during the minor illness in the mother. Don't take any medication without consulting your doctor. Don't give pre-lactals like your powders and the other supplements without consulting your doctor. Don't diet. Don't diet during the lactation period. This is a period to bond with your newborn baby, to heal yourself, and to get back to the shape later after the 6 months. So even the your doctors also suggest if you want to start the exercise, do it after the 3 months. So not immediately after post pregnancy. So that's all from my side. So if anyone has any questions, just please let me know.
Thank you, Vijeta, madam. So we can continue the question and answer session later on, and all the viewers can write to us also if they have any requirement, anything they want to know on nutritional requirement from us. So after this, I would like to request Salam Pavitri Devi from NH Guwahati to highlight or help us on the neonatal care. Yeah, Pavitri, your mic is on mute. So can you unmute? I'm not able to hear you. Can you be
You're not
louder?
audible.
Yeah, Pavitri, I'm not. You're not audible. Can you just? Yes, I think it's.
No, ma'am, not.
I think there is a network issue. I think. Can you just replug the headphone, or you can remove the headphone also. You can remove the headphone.
Rumini, am I audible?
Yes,
Yeah,
ma'am, you're
yeah,
audible.
you're audible.
Yes.
So can you present the slide, or I can present it for you?
Sumini, am I audible now?
Yes, you're audible.
So, good afternoon, everyone. So, today is a special occasion of uh, on the topic of the breastfeeding week. So, I'm going to little most of the points already Dr. Bujeta and Dr. Partha has discussed. So, I'm going to discuss you little about the how to give the breastfeeding technique and the neonatal care. So, Rumidi, आप slide Rumidi.
Okay. Okay, just give me 1 minute. Can you see this?
Yes, ma'am, it's
No
coming.
remedies. Yeah, it's maybe
Visible now.
network issues.
Is it visible?
Yes,
Poetry?
it's no remedy. Ah, yes, yes, yes. Now I'm
Okay, please carry on.
so myself. Yeah, am I audible, remedy?
Yes, yes, you're audible.
Okay. So next slide, please, remedy. So, so essential care of the normal healthy neonate can be the best provided by the mother under the supervision of nursing personnel. About the 80% of newborn baby require the minimal care. The normal term baby should be kept with the mother rather than a separate nursery. Grooming and in promote better emotional bondage, prevent a cross infection, establish the breastfeeding easily. So mother participate in the nursing care of the baby and develop the self confidence in her. So Rumindi, next slide please. So before the breastfeeding, I'm just going to little bit tell about the care of the baby after the birth. So the
Just give me 1 minute.
so daily routine of
I'm
the
just
neonate.
leaving.
So daily routine care of neonate is am I audible, Rumidi, now?
Yes, ma'am, you're audible. You can continue, ma'am.
Okay. So as majority the babies cry at birth. The take the spontaneous respiration, no resuscitation required at birth in about 95 and 98 neonates. So that is very important to keep the baby warm and start the breastfeeding, close observation for early detection of problems and protection from infection and injuries. So the care of the umbilical cord and wrapping with the soft cloth and is are very important for the newborn babies. So next slide please, Wendy. So an identification tag to be tied to the mother and baby and is also very important. So recording or record of the details of the babies and like birth date, time, sex, examination finding and presence of any problems after the delivery and also is very important. So this next slide please, Sumiti. Next please, Sumiti. Next slide please, Sumiti. So keeping the baby warm, okay, warm. Previous slide, Sumiti. Previous slide, Sumiti. Acha. So keeping the baby warm and warm is provided by the keeping the baby dry with the adequate clothing. So baby should be kept in the side of the mother and so that the mother's body temperature can be to keep the baby warm. So baby can be placed in the skin to skin contact with the mother. Is a we used to say the kangaroo care to maintain the temperature of infant and facilitate breastfeeding. So bathing at the first day is to be avoided to prevent the hypothermia. Next slide, please, Midi. So skin care of the baby also is very important. The baby must be clean of blood, mucus, and meconium. No vigorous attempt should be made to remove the vernix caseosa, as it provides a protection to delicate the skin. So baby bath can be given in the hospital by using the warm water and at the warm room gently and quickly. So bathing should be avoided in the open place and some privacy has to be maintained. So while bathing the babies, an environment should be very clean and comfortable the place. So next slide please, Ramidi. So giving the applying the oil and giving the massage to the baby also is very very important to improve the blood circulation of the baby. So exposures to the morning sunlight also is important to get the vitamin D source to the baby. So next slide please, Rumidi. So care of umbilical cord also is very important. The umbilical cord is cut about the 2 to 3 inches from the navel and aseptic precaution during the delivery and tie with the cotton thread or disposable plastic clip. So you will have to inspect the whether there is a bleeding or not. So and the any infections and the condition of the umbilical cord should be observed as the nurse, and if anything found on, and it should be immediately report to the doctor. So no dressing should be applied, and the cord should be kept open and dry. Normally it falls off after 5 to 10 days. So application of the triple dry and junction violet is not avoided advocated as a routine anymore. Next slide, please, Ramidi. The next slide. So, care of the eyes also is very very important, and how to give the care. Let's say eyes should be cleaned at the birth and once every day using the sterile cotton swab, soaked in sterile water. Each eye should be cleaned using a separate swab, and swab should not be mixed, and it should be separate. So application of kajal should be avoided to prevent the infection, or it may lead to the and poisoning to the eyes of the baby. Eyes should be observed for the redness, any discharges, and any excessive tearing, and is very very important as a nurse, and we should observe, and for the healthcare provider, for it is a very important. Next slide, please. Maybe next slide. So clothing of the baby and with the soft cloth and is also very very important. So bottoms and synthetic frock, plastic and nylon napkins should be avoided. So while we are clothing the baby, so clothes should not be very tight, and neck and mouth area is try to be avoid and not to cover, and it may create to the suffocation to the baby also. Maybe next slide please. So general care means like baby should be, and baby and mother should keep in the well ventilated area. Should the area should be and clean, and hand hygiene is very very important. And the रूबी जी थोड़ा स्लाइड थोड़ा बड़ा कीजिए ना. Ruminde, I am unable to see slide.
Can you see that?
Yes, Ruminde, now I can see. Yes, Ruminde, I can see. So some general care. So baby they should be kept in the privacy and when ventilated room. So baby should be handled very gently, and after the hand hygienic also is very important before touching the baby. So no infected person should be touch the patient and should be take care of the baby. So babies should be allowed in a sleep and in a supine positions, which can prevent the sudden infant death syndrome. So wet nappies and diapers should be changed immediately and to prevent any redness infection in the area. So observation of the baby by using the Apgar score is also is very very important. So Apgar score means is a tool and which we can use, and it is a very useful for the assessment of the baby. So like A means appearance, P means pulse, G means grimace, A means activity, and respiration. So according to the score, so we can take the immediate resuscitation of the patient if we found the high risk and or the severe score. So we can give the immediate care to the patient. So next slide, Rumidi. Next slide, Rumidi.
Obituary weight recording. Is this a slide? Can
Yes,
you
yes,
see?
yes, yes, yes. So recording of the weight also is very important. So from the SS daily weight gain in healthy term baby, which is about 30 gram per day. So most infant double their weight by 4 to 5 months, but in the first week of the life there is a physiological loss of the body weight because of removal of vernix, mucus, blood gases or mucosium, meconium, and reduction of extracellular blood volume, also due to the adaptation of the new environment. So with the adequate breastfeeding, they can maintain the baby's body weight, and can regain the lost body weight also. Next slide, Rumidi. So immunization also is very very important, and everyone knows. So immunization of the baby. So next slide, Rumidi, please. So now I going to little about the breastfeeding, and already Doctor Partho and Doctor Vijeta tell about the breastfeeding and importance of the breastfeeding, contents of the breast milk. But I just want to tell a little more there. So the baby should be put on the mother breast within the half an hour of birth as soon as possible. The mother has recovered from exertion of the labor. So colostrum feeding must be offered. Mothers should be informing about the important and techniques of the breastfeeding. Demand feeding should be encouraged. Exclusive breastfeeding procedures should be explained to the mother and family members. Maybe next slide. So let's see what is colostrum. Next slide, Pramidi. So the first few days after the birth, your breast make an ideal first milk. It's called colostrum. Colostrum is a thick, yellowish. There is not a lot of it, but there is a plenty to meet your baby's nutritional needs and immunoglobulins. Colostrum helps the newborn digestive tract develop and prepare itself to digest the breast milk. Next slide, please, Midi. So, benefit of breastfeeding for the mother baby. So, breast milk provides the ideal nutrition for infant. It contains the mix of vitamins, protein, and fat. So, everything your baby needs to grow. It provides in a form more easily digested than the infant formula. Breast milk contain antibodies that help your baby fight off viruses and bacteria. Breastfeeding has been linked to the higher IQ score in later childhood. In some studies, the physical closeness skin to skin touching, eye contact, all help your baby bond with you and feel secure. So breastfeeding also plays a role in the prevention of sudden infant death syndrome. Next, Rumidi. So benefits to the mother. So breastfeeding burns extra calories, so it can help to lose pregnancy weight faster. It releases the hormone oxytocin, which help your uterus return to its pre-pregnancy size, may reduce the uterine bleeding after birth. So breastfeeding also lower your the risk of the breast and ovarian cancer. It may lower your risk of osteoporosis too. Since we don't have to buy and measure formula, sterile nipples or warm bottles, it is the time consuming. It saves the time and money also. It gives you the regular time, relax the quietly with your newborn as you born. Next slide, Rumidi. So these are the techniques of breastfeeding. So there is a many techniques to feed the baby. So first is the cradle position, second side lying position, cross cradle on transition hole, clutch or football hole. So lay back position. So those are the techniques of the breastfeeding. So next slide, Billy. So techniques of the breastfeeding. So latch on and ditch latch. So baby open the mouth wider, the chin touching the breast, the thick lobe flattened, the lips are flung out, the breast look full and round. So mother has to hear the sound of the baby sucking and swallowing. The nipple lock long and the round after the breastfeed. So these are the slats of after the baby. So use little finger press on the gum and to open the baby mouth and to dislodge from the nipple. So we are not trying to do the suddenly dislodge of the baby. Okay, it may feel the pain and so later on may have the problem. So next slide, Rumidi, please. So is your baby getting enough milk? So it's very very important for the mother. So many breastfeeding moms wonder whether their babies are get enough milk for the good nutrition. So not more than less than the 7% of their birth weight in the first week day after the delivery. So your baby is latching on correctly or breastfeeding every 2 to 3 hours. So have at least 6 to 8 diapers a day, and it need to be changed, and it should be diapers should be wet with the very pale or clear pee. So regular bowel movement also is important, or it's from that we came to know that the baby is taking the enough milk. Next slide, Rumidi. So tips for new breastfeeding mom. So get the regular prenatal care to help you to avoid the preterm baby. Ask the doctor to plan the breastfeeding. Ask of support the facility to plan the delivery. So in offer to help your breastfeeding after the birth, ask your doctor to connect you with the lactation consultant who can teach you breastfeed basics. So it's very important. Take a breastfeeding class, tell your doctor and hospital care provider. So and then you want to do the breastfeeding as soon as possible after delivery. So stock up the supply, and you need to breastfeed such as a because using the tight cloths and bras is also to be avoided. Next slide, Rumidi. Awareness. So Rumidi is a continuation. Okay. So awareness of the mother. What's your baby sign of the hunger? So the sign of the hunger I will show you later on.
Pavitra, just give me one moment.
Okay.
There's a network issue, I think. Partuna, there is a network issue, I think. I'm not able to get you in.
I mean,
Give me 5 minutes, I can share after that we can do, I think. Pavitri?
Yes, Lee?
Yeah, where it is like, yes.
I think there is some network issue from Rovi ma'am's side. I'll just check it out.
I think we were having some problem, network issue. So can you hear me, everyone? Am I audible?
Yes, ma'am, you're audible.
Hey?
Yes, yes.
Okay, okay. Just the last slide. I'm so sorry about the presentation commentary. There is a lot of network issue in my place. Pavitra, this is a slide.
No, Rumini is I'm unable to see.
Is it coming? Is it coming?
No, Rumini. No.
Shakti, can you see my Shakti, can you see my
Oh,
slide?
it's I can. So I'm. Yes, Rumini. Now I.
Yeah, Pavitra.
So
Please continue.
next slide, Rumini. Next slide.
This one, sign of your baby is hungry.
No, Rumini.
Yes.
Previous. This not this one.
After this one.
Yes,
Pavitra.
Rumini, this one.
Okay. Please continue.
Yes, this one. So awareness of the mother. So watch for your baby sign of hunger. So this is called a demand feeding. So hungry infants move their hands. Later on, I will show the picture how the signs of the hungry. So make sucking noises or mouth movements or move towards your breast. Don't wait for your baby to cry. So there is a signs that the babies are too much hungry then. So while we are giving the feeding, so be patient is very important. So breastfeed as long as your baby wants to a nurse each time. So don't you should not be very hurry while we are giving the feeding. So comfort, this is the key. So relax with the breastfeeding, and your meal is more likely to let down and flow. Get yourself comfortable with the pillows. That means the comfortable position is a requirement while we are giving the feeding, and relaxation, and should not be stressed while giving the feeding both the babies and mother. So breast milk only for the first 6 months until the this up to 2 years. I Dr. Pato already told. Avoid the teats and dummies and complementary feeds. So baby is trying to learn the mother nipple to suck the feeding. So during while taking the breastfeeding, so we should not try to the any teats or dummies to the baby. So baby might be confused. So keep the baby in the room with the mummy. With so feed on the demand and according to the needs. So stay together after the birth, and keeping the mummy and the babies together is very very important. So next slide, Rumidi. Next slide, Rumidi. So it's a signs of baby is hungry. So licking their lips or sticking out their tongue, looking, and which is moving their jaw, mouth, or head to look for your breast. Putting their hand in their mouth, opening their mouth, queasiness, and sucking on the things. So these are the signs of the baby, signs of the hungry of the baby. So next slide, Rumidi. Next slide, D. So can I get the help with the breastfeeding? So the new mothers, so they require the training and help from the other, so from the doctors or other the trained peoples to how to give the breastfeeding. So she can take the help from the family members or from the friends, from the doctors or baby doctors, the hospital or the center where the baby was born, lactation professionals or baby nurses, lactation centers, or breastfeeding website and forums, and breastfeeding organization. From there, the mother can learn or get the knowledge about the breastfeeding. Next slide, Rumidi. So, follow up is very very important after the baby birth. So each infant should be follow up at least once every month for the first 3 months and subsequently 3 months interval in the 1 year of the age. Follow up is necessary for assessment of the growth and development, early detection, and management of health problems. Health education should be given to regarding the exclusive base breathing, warm hygiene, grooming, clothing, immunization, and it should be follow up. So harmful cultural practices should be discouraged to the mothers. Care at home should be discussed and demonstrated to the mother and family members. So the next slide. So newborn care is very essential to reduce the infant mortality and morbidity rate. So these are the bibliography, and thank you. And special thanks to Rumidi to give me the chance to join us as kind of webinar. Thank you so much, Rumidi.
Thank you, Pavitri, for such a beautiful presentation and knowledgeable session. So after this, I think we are at the end of the session today. So if anyone is having any doubt, any question, they can ask. And Shakti is there. Shakti, if you have any queries or if we have any question from the audience or team, you can ask on their behalf.
Yes, ma'am. Actually, we have a question from Dr. Suchna, ma'am. I think this is for Dr. Partho, sir. How soon should we start feeding the child after the birth? How immediately we should? Sir, you're not audible. You're on mute.
Um, start as soon
Sir, can you just repeat it because you're not clear?
question is, I think, how early the breastfeeding should be started. Uh,
Yes,
some
sir.
as soon as possible, as soon as the womb, they should be kept in the mother's lap and ready to start with the breastfeeding. We don't
Okay.
have any time frame. Immediately, they started feeding as soon.
Okay. I have a question, sir, for you. That you discussed or told us about the express milk. That is, nowadays mothers are storing their milk for their child because as they might be working or going out somewhere. So, is that express milk which they store for the children is good enough? That means, is it that nutritious that we should be giving to our child after the birth, after storing it?
We're pressing out milk. The baby breast milk is kept in the room temperature for the first 6 to 8 hours. It's sufficient. Of course, sometimes we have got this breast milk well for 3 days. But you can store your breast milk and it can be kept in the freezer for 24 hours. And if you keep it in the deep freeze, it can be for months also. Apart from it usually doesn't give us any milk. We don't giving of other milk in the stored milk so that the contents remain the same. For day to day, if it takes 6 to 8 hours, it's not going to hamper, it's not going to bring down the quality of milk. Don't worry.
Okay, thank you so much, sir. I have a question for Vijeta, ma'am. Actually, uh, yes, ma'am. I just wanted to ask one question: is there any particular diet that has to be followed by a would-be mother before the birth of a child, so that it will help her in production of the milk more proper? Because we have discussed about so many things during the breastfeeding and everything. So before that, can a woman or a mother can prepare herself and get the nourishment for her child?
Before, it's not possible basically, because only after the pregnancy, when the prolactin hormone comes into the action, then only the secretion of the milk starts. So yes, there are many things the female can do if the milk production is low, like the methi seeds, zira water, and fennel seeds, your berries, handful of berries or whole grains. These, when the diet is much balanced and your hormones are in like good levels, so definitely the milk production will be good. So that's why we keep on telling the processed food has to be less. There are some 10 things you can do in your diet for the good production. Include good quality of protein in your diet. Second, whole grains are must in each and every meal. Even the protein, like 20 grams of protein, each and every meal has to be there. Even in the snacks, snacks should be consist of more of the proteins, not just the carbs and the deep fried. Your yogurt, your curd, if it's homemade, very good because it's probiotic. It helps in the building of the gut, and that's why the milk production is good. Your methi seeds, ajwain seeds, your fennel water, these are awesome things what you can include in your diet. The handful of nuts, because it's a very good source of omega 6 fatty acid. Okay, so these things we are called as the galactose, which helps in the production of the more milk. So these things will take care of this. So that's how your milk production will be of good quality. So, but before the pregnancy, it's difficult to address that because that time your hormone is not into the action and you can't store the excess of milk. And nowadays, we have seen that the excess of breast milk also causes the breast abscesses. So it's very important at the end of the day, you have to empty your breast so that the fresh milk production should be there, and that is not going to harm your baby and you, especially. So that's how you can take care and the diet of your
Right,
child.
If
right,
I can, if
absolutely.
I can
That's
add in, I think the
Yes.
best galactogog that you have for a mother is her confidence. You need to keep your confidence high. You need to be very happy. You should be anxiety
Yes.
free, pain free, and then only you'll be able to breastfeed. Think lovingly of
True.
your child. The prolactin
That's
hormone is actually basically is a happiness dependent hormone. A mother who is happy and confident will always produce a lot of milk.
correct.
So be
That's
confident. That's the
absolutely
only
correct.
way.
Yes, yes. Thank you, sir. Thank you, sir. Thank you, ma'am. Thank you, Vijeta, ma'am. I have another question, ma'am. I usually see our family members advising our new mothers that eat a lot of dry fruits, almonds, all these things. So, does it really have contribution in providing that amount of proteins? Because we see a lot of dry fruits. What to eat and what not to? Almonds, particularly. I hope you
Yes.
understand that is the thing which is included in every mother's regimen, that I
Yes.
should be taking this in early morning every day.
Yes.
So can
So,
you say something about
yeah,
that?
we'll include the dry fruits early in the morning. See, after the fasting period, during the lactation period, especially because you are night feeding, also, there is a lot of gaps in your, if you are having like 8 o'clock dinner, after that, you are going to have 6 to 7, 7 hours of fasting, then only you are. So, why the nuts will prefer nuts and the fruit? You have to start the day with the nuts and the fruit because, see, it's like a kickstart your metabolism. We don't want to overload, because when you are breaking the fast, if you will see the navratris or any other the long regime fast, so we don't overload the stomach because your stomach is not ready for to take the heavy things. So, but the proteins, yes, proteins are good in your dry fruits, and but more than the dry your proteins, your omega 3 is good, fiber is good, which will help to kickstart, which will give you immediate energy, and your stomach will start getting ready for the heavy food like your chapati, your poha, and other things. So that's why it's good to start your meals with. But now the dry fruits, it should not be in the kgs. It's only the handful is allowed. Okay,
Right.
so whatever your hand is, so a handful, because these are the dense calories. These are the dense calories, and it generates the heat a lot. So it has to be raw nuts, has to be soaked. This is the first principle you have to follow. Whether it's your almonds, whether it's your walnuts, whether it's your figs, whether it's your raisin, it has to be soaked for the 6 to 8 hours, and then only you can have it. Okay, that discard the tannin, also better nutritional value you will get and your baby will get. And it should be just a handful. You can divide it into the 2 3 portions, so that a little bit of in the morning, little bit in your evening snack, you can place it like that. And fruit has to be accompanied because it will immediate help in the glycogen storage, right? So it will
Right.
give you the energy. So that's why you have to start your meal with the lighter, but it should be calorie dense, not with the very heavy meal, because your stomach is not ready for that. And some females can get the nausea if they immediately have the heavy, like the paratha, roti, sabzi, and so that's why it's a transition period. Like how we'll transit the baby, from the mother's milk to the semi-solids and then the feed.
Right.
So that's how
Right.
we have to transition.
Thank you so much, ma'am. I have a question for Pavitri Devi, ma'am. Okay. Yes, ma'am. I just wanted to ask, immediate, bathing of the child after the birth. Once they said, you said that it is not advisable, but we can go for a warm bath. I mean, can you just elaborate on that, Pavitri Devi, ma'am? Clearing all the mucuses and everything which is present on the child's. You're not audible, ma'am. You're on mute.
So after the birth to immediate bathing means that, so this is a new environment. So it must be avoided.
Yeah.
So like giving the sponging and cleaning is, it should be done, but the giving the bath is must be avoided to prevent the hypothermia. So baby just birth, and this baby is trying to adjust with the new environment. So it's very very important to prevent those. Yeah. So bathing after the uh, immediate birth.
Right. Okay, okay. Thank you so much, ma'am. Uh, we'll see if
If
we
I
have
can
any
come
other.
in and add,
Yes, sir, you can speak.
can I add to the bathing question? Yeah, I
Yes, sir.
believe,
Yes.
see, the main idea behind not giving bathing, the main idea behind not giving bath to 24 hours is to prevent hypothermia. And second point, you need to be clear that we should not clean these
Yes, yes,
vernix that are there in the baby's skin. These are actually protective for the baby. These acts as
Right.
emollients for the baby's skin, and these also prevent hypothermia once the umbilical cord falls off and it becomes dry. So usually bathing is allowed only after 10-14 days, and sometimes babies who are born to mothers with suppose with HIV infection or with hepatitis B infection, only in those cases we allow bathing as soon as after delivery. Other than that, usually bathing is avoided.
Thank you so much, sir. Thank you, everyone, for a wonderful topic. We have chosen the breastfeeding week, and we are very much glad and thankful to the entire panelists. We will be celebrating with lot more events coming up with some live events for the mothers, and also we are coming up with new topics like know your rights for all the women. And over to you, Rumi ma'am, if we have can do the conclusion part.
I was actually chatting with Irene. She's not able to enter because of some network issue in her area. She's from Dibrugarh. I think some network issues is going on. So we'll connect her in the other work or other schedule in the coming week, because we'll continue this campaign for another week, first to seven. So we'll be having different activities, session, then work, and a lot of other things. So we'll connect you everyone, and please bear with us for entire campaign. So thank you so much. And for audience also, if there is any doubt, any question, if you want to ask to our speaker, then you can write to us, or you can also send a text message, or you can also send a message through the messenger as well. So thank you so much. We'll connect soon again. Thank you, Parthada, for being here with us. Thank you, Vijeta ma'am. Thank you, Shakti.
Thank you
Thank
so
you,
much.
Pavitri, for being with us.
Thank you
Thank
so
you so
much for providing this opportunity. It's like educating the 10 people is like educating a family. So it's great opportunity to be here. Thank you so much.